Assalamu alaikum everyone, and welcome back to my YouTube channel. If you are new to my channel, then subscribe to it and press the bell icon for the latest updates. Without wasting your time, let's start. Today, I will discuss last drug of that is Loratadine. If you want more video related antihistamine topic, then comment. Before discussing, we should know about what is antihistamine drugs. Antihistamines are used to relieve or prevent the symptoms of hay fever and other types of allergy. They work by preventing the effects of a substance called histamine, which is produced by the body. Histamine can cause itching, sneezing, runny nose, and watery eyes. Now I will discuss the drug that is used as Loratadine. Origin. Loratadine is an antihistamine that reduces the effects of natural chemical histamine in the body. Loratadine is a second-generation peripheral histamine H receptor blocker used in the treatment of allergies. Plant source of beta-histine is still unknown. Mainly it is chemically prepared. Dosage forms of Loratadine. Tablets forms. Syrups. Mechanism of action of Loratadine. Loratadine acts as an anti-allergic agent via blockade of histamine action at the histamine H1 receptors. Indication. Seasonal allergy. The side effects of Loratadine are sedation, drowsiness, headache, hallucinations, confusion, nervousness. Drug interaction. May increase plasma concentrations with inhibitors of CYP3A4 and or CYP2D6, e.g. cimetidine, erythromycin, ketoconazole, clarithromycin, quinidine, fluconazole, fluoxetine. Concomitant use is avoided. Warnings and contraindications. Hypersensitivity to Loratadine. Use with caution in the following. Phenylketonurics may contain phenylalanine. Renal and hepatic impairment. Geriatrics. General considerations. Advice the patient take with meal or without meal. Advice the patient to avoid alcohol intake and other central nervous system depressants. Advice the patients against involving hazardous occupations requiring complete alertness like operating machinery or driving. Monitoring parameters or tests of Loratadine. The patients that use Loratadine should perform following tests. Patients taking Loratadine require monitoring serum creatinine level, because it affects serum creatinine level. Commonly prescribed brands. Tablet Soften 10 mg. Tablet. Antiel 10 mg. Dose. 10 mg OD. If you enjoy this video is informative, then like, share and comment, and any question about this topic you can ask in comment section, and give me any suggestion about my lectures and follow on LinkedIn. The link is in description section. Thanks for watching.